Dr. Stewart here. Want to share another great success story. This is Greg. Greg, thanks for sharing your story with us. So Greg came to see me several months ago, and he was dealing with a lot of pain along his plantar fascia. He was dealing with a lot of pain along his tendons on the inside of his foot. And we always talk to our patients about how we can get them better. And we did a lot of medical treatment with in our field we tend to use a lot of medical equipment because a lot of our problems are biomechanical. We set him up with some braces and splints. Tell me your level of pain before you came in.
It was probably about an 8, 9. I could hardly walk at night.
Right. And you were struggling.
Yes.
Yeah. So one of the things that Greg, like a lot of our patients, has struggled with is also a part of getting better is identifying weight issues, and he had some weight issues. And I want to be very clear. When we treat the foot and ankle without addressing weight issues, we often see success. However, when there are weight issues, a lot of times the recurrence is very quick and it's very frequent. So when we treat patients for foot and ankle pain and pain throughout their body, you want to try to identify the underlying causes of their problem. So we set him up with a nutritional counselor, and tell me how it's been going.
It's been going well. We've been working with her. My wife and I have been doing this as partners, which has been so much easier.
Which I will interject and say that is an important part, because when someone has a spouse or a significant other or just lives with their kids, it's very important when you're trying to eat a certain way that everybody in the household is eating that way. Because when one person does it and the other doesn't, it's a crash and burn scenario. Go ahead, I'm sorry.
Yeah, so one of the things that we've been doing and also implementing strength training, which we're doing a lot of the exercise that you started me with that are incorporated into what we're doing. It's made incredible results. I've lost 27. My wife lost 14 since right after Easter when we started.
Amazing. And how's your foot pain?
It's doing very well. It's doing very well. When I have a flare, but it only lasts for a matter of a day, and it was because of wearing boots. I had to wear boots one day for a wet event I was working. But like my wife, you weren't able to walk for like a day or two without hobbling around, and it's just I have all the tools now.
Awesome. So we've got him in the right shoes, the orthotics.
Yeah.
You're off your blood pressure medicine, I believe.
Off the blood pressure medicine. Yeah. My primary care is just documenting me. She's had me come back because she's watching this whole thing, and she's like, I need to get my husband in to listen to, go to the foot doctor.
So we've had a lot of great success stories, and this is one of them, and he's got to maintain it, so we really emphasize low impact exercise. We want to keep people moving so that they can also get their feet better. So low impact exercise typically is biking, rowing, swimming, and strength training. I think a lot of us, we tend to, and I used to do this, we tend to overlook strength training. We do a lot of cardiovascular exercises. It doesn't mean you need to be Arnold Schwarzenegger, right? You don't need to be a bodybuilder, but you need to move a little weight, which will help control your glucose, your blood pressure, and it'll also preserve your feet. And the strength training we emphasize is seated weight training. We don't want to put weight on our feet. So Greg's doing great. Another great success story. We appreciate you coming to see us. Thank you.
Sir.
Excellent. Thanks. Good.